is a painful part we're going through. Painful in the sense that since February 27th, when COVID-19 started in Nigeria, it has exposed the deficiencies in the health sector. As of today, you have lost over 17 members to COVID-19 infection, with about 1,824 that have been confirmed cases of resident doctors. We are not just fighting for just resident doctors, we are fighting for all health workers. In the sense that if as a doctor or as a health worker, as a nurse, a lab scientist, you are made to receive 5,000 naira as your hazard allowance, and you know you put in all your best in trying to save lives. I'll give you a practical example. A resident of ours that worked in one of those big teaching hospitals, let me not call names, she got infected with COVID-19. She went home, infected her husband and her children. And they had to stay indoors for like four weeks before our result came out negative. Why somebody that works in the chambers, upper and lower chamber, is as part of his allowances, is paid hardship allowance of 1.2 million naira. That shows where our priority lies. How can a doctor that have worked, a nurse that have worked, and because of the COVID-19 dies, leave loved ones behind, and they still are not paid death in service insurance? Every health worker, every Nigeria deserve a good health insurance. In other countries abroad, in the US, UK, they insure all Nigerians. As it stands in Nigeria, do you know that the National Health Insurance Scheme cannot even afford to give you 5,000 naira to buy good drugs like Augmentin? They give you lesser ones that have less value to you. You saw some weeks back when some doctors in Jute went on a street protest to protest about them not being paid 5,000 naira. You saw some months back when my name was placed on Twitter telling them to please greet the president for neglecting them, for not being paid 4 months of their salaries. Doctors have been turned to alms beggars. They beg money from nurses, people, parents, and everybody around just to feed, just to go to work, just to pay their rents, just to pay the school fees of their children. Why people still feel we can come and sign memorandum of actions and tell them that you're still going to pay them 4 weeks later and tell them to go back to work? The Hippocratic Oath has said that the health of the doctor also matters. That means if you send a doctor that is hungry and have not been able to eat or buy his basic necessities, and is a dependent, people depend on him, and you expect him to go and give care to somebody, and when he does something wrong, his license will be seized. That shows we're not being sincere to us also. I'll talk about medical tourism. Medical tourism is what we have found ourselves in since the COVID-19 ban on traveling was lifted. And now you see most of our leaders, for headaches, for mere sneezing, they go out to invest the money of Nigerians, taxpayers' money, and go to seek for medical care abroad. It's a shame on our part. If those money is put into all hospitals in Nigeria, we would not need to travel. So that's the place we find ourselves. And we are feeling by now, after the ultimatum we gave since January 25th, we would have had response from a government that actually cares for its citizens. Only for us to come and call for meetings just a week before the notice of the strike. It's irresponsible. And I think Nigerians should call the government to bear for anything that happens to anybody, any patient that is ill. The government should be sued and take responsibility for the bad actions they have led us to. resident doctors were like 16,000 resident doctors in Nigeria, and we form about 70% of the workforce. But resident doctors are levels below the level of consultants. And I know for a fact that our consultants have been taking care of patients since we began our strike on the 1st of April. Patients are not neglected. Patients are seen by consultants in the accident and emergencies in the clinics and the hospital. Shows that since the organogram still works, there may be a burden on them, which is why we are calling on government to please hear to our plight so that we can go back to work. We have been patriotic enough for over a decade now, because the same thing we have asked for, the same thing we are still asking for. The only difference being the remunerations for the interns and the residents on gift mix. If the government has been responsible, we don't need to be adding more issues to that list of things we wrote down. And we should have been thinking of just the remunerations now. So I think there should be consequences for those that led us to the strike. Because if there's no consequences, it keeps on reoccurring. And the citizen thinks that we're just fighting for money. We're fighting for survival. Because the average doctor now cannot even breathe, cannot eat, cannot meet his basic needs in life. And such person cannot function properly. We are going to continue a total and indefinite strike if our demands are not met. And we call on sane Nigerians and our beautiful Nigerians to please call on government to hear to our plight. Pay them their four months salary, insure all doctors, increase the hazard allowance to at least 50% of the basic salaries. Those are ways in which you can prevent brain drain and allow Nigerians and health workers to stay in Nigeria and to be more patriotic.